Welcome back to West Texas View.
Welcome back. We're talking with Dr. Cola about some of the childhood issues that parents face when dealing with the health of their children. And we were talking about asthma earlier, and we're going to continue that discussion now. Dr. Cola, talk to us a little bit about asthma attacks. Is there something that can be done on the part of the parent or the child to prevent an attack?
Yes, Johnny, as I explained to you earlier, that there are extrinsic causes for the asthma attack to happen, especially when there's a change in weather. And these days we've seen tremendous ups and downs in the weather in Odessa, and I've seen a lot of kids coming in with asthma attacks. So regardless of they are on their medications, it's still possible for them to have these attacks because there's some triggers. So it's very important for a pediatrician and also for the parent to identify what the triggers are. So even the weather is fine, but the kid has been taken in a backyard and somebody was doing barbecue, and then that smoke will trigger. Mom's strong perfumes can trigger an asthma attack, and sometimes even the air-conditioned smell can trigger the asthma attack in a patient. So it's very important to identify those triggers. So asthma is all about prevention. So how you prevent the attack? And there's a medication that everybody uses, and I'm sure everyone is known. It's a bronchodilator, meaning it enlarges, because asthma causes constriction of the bronchioles and alveoli, the smaller airways, and this enlarges it. So the moms think that they have this medication handy and they can use it anytime as and when they have. And I would want to tell you that it's a rescue medicine. That medication for asthma is to prevent the attack. It does have a great effect on the lungs, but it has a significant effect on your heart. So the idea of using this medication is not, using this medication often is not good. So you just have it to prevent the danger or the deadly stuff, but it's not like a daily vitamin that you take it. So I do tell the moms that please don't use it if it's not needed. And if I give them a prescription, it's technically supposed to last them for 6 months to an year, and they come to me every month to refill, that means the kid has been having a lot of attacks, and then he needs something else to control the use of that medication. So as again, every medication goes with a side effect, so I explain to them that don't abuse the medication,
Right.
but use it when you have to use it.
Right. So then how often should they be checked by a pediatrician just to kind of chart their progress?
Right. If we diagnose somebody like newly onset of asthma, we examine them at least every 3 to 4 months. But again, even if it's a severe asthma or a mild asthma, we always want to keep a track of the kids, because an intermittent case or a stage 1 case can go to stage 4 like that because of change in environment, and maybe the kid is 10 years old, now is a teenager, now we started to smoking, and then things can change even worse. So it's always a good idea to keep a track. So you have to follow your patients to make sure that they are doing this. And it's an excellent way that we have in our clinic. We give them handouts. It's a patient tool that the parent and the child actually can look into it. It has phases of how you feel today, how many times have you had asthma. So there's a scoring. Based on that scoring, we gauge them. Okay, you've been like this for past 3 months, so I think it's time we upgrade your medication. Or you've been doing excellent and I don't think you need this medication. So either we go up or step down based on how they do. So this progress is charted on with your pediatrician every 3 months. So if you did not have an asthma attack for 6 months, don't think you can miss an appointment. It's always a good idea to catch and find out what you can do to keep it away all the time.
Right.
So don't say hello to asthma attacks, keep it away.
So just out of curiosity, because I had told you off screen that when I was young, I had asthma, but then I outgrew it. How
Right.
often does that happen?
It happens based on what triggers the asthma attack. So again, as I mentioned it to you, it all goes back to your genes, your intrinsic and extrinsic. Intrinsic problems stay with you for the rest of your life. It's very hard to come out of it. But extrinsic, as maybe something has triggered you all the time and you have been in that environment which there was a constant trigger. Say some of them have been living with cats and dogs, and then the dust and the pollen all the time, and that might have triggered the asthma. Once they avoid or once they move from that place, the asthma attack kind of gets better. Like I was in Jersey and I had frequent attacks because of the pollen that I was exposed there. Now I come to Texas and I don't have that, so here I am.
You don't have any problems?
No more asthma attacks since
That's
1 year.
great.
So that's again,
wonderful.
yes.
That's great.
That's-
Well, that's
how it
also
feels.
encouraging to parents, so that
Right.
it may not necessarily be a lifetime issue. It may be something that the children will
Right.
move through as they grow older.
Yeah, and we pediatricians definitely take importance of this in labeling anybody as asthmatic, because usually moms say, my kid has an asthma attack, and it's a first wheezing episode. It's definitely not asthma. Maybe it's just another lower respiratory infection, like a bronchiolitis or anything else, or an influenza. influenza which is causing, or a pneumonia which is causing it, but we don't label them as asthma. So again, to come down to a diagnosis of asthma, we give them a benefit of doubt. We see them 2 times, 3 times, and then we see, okay, he's responding every time with this medication, and that's why we label it. So when a pediatrician labels you asthmatic, please make sure that you follow up with them.
That's good advice for just about anything when it comes to your health.
Yes.
So let's talk now a little bit about children and constipation. Is it something that presents itself often, and how does it present itself with parents? And
Right, and I believe everybody knows what the definition of constipation. It's kind of a little tricky for pediatric age group. For less than 1 year, we do not call the baby constipated if he doesn't poop even for 3 to 4 days. So that's still okay. And if it's a baby, if it's just breastfeeding or formula fed, we let them go without it for 1 week. So the moms will be surprised. Can my baby not poop for 1 week? Yes, it's still possible. Reason, you're still in the process of maturation. As long as your baby passes off complete stool at the end of 1 week, it's not bothering the baby is still active and it's smiling, sleeping, drinking okay, and is not causing any blood in stools, it's okay. You do not call them constipation. Yes, it's okay that every time he poops, probably it's a little uncomfortable for the baby after 1 week, and for the parents too, but it's still okay. The definition changes according to the age. After 1 year, if they don't poop for about 3 days, then that's constipation. And again, it doesn't just restrict to the number of days. It is also defined based on the consistency. And if we take a survey, I'm sure most of them will be constipated, all our patients. So we ask them how the consistency of the stool is and how often they go, and based on that, we try to deal them. They are medications that we deal differently with different patients. Yeah.
So it can be treated.
It is.
Okay.
It is. So they are dietary measures, they are non-medical measures, and they are medical measures how you treat the constipation. Definitely we tackle when they have severe constipation or an acute constipation, stopping them to do the day-to-day activity. We target them with medications first. But after that, after they're done with that, we start them to treat with non-medicated measures, because it's okay to clean up your bowel, but you have to prep your bowel every day. So that comes the role of water, diet, vegetables, and fruits, which I'm sure not all of us stick to that because of all these fast foods and fast life and working moms and working parents. Kids are actually deprived of all these things. Yeah,
that's wonderful. It's good to know. When we come back from the break, what I would like to do is spend a little bit of time talking about moving beyond constipation to maybe diarrhea and some other issues that they face as children, and if we have time, even talk about some of the issues associated with obesity and diet. So we will take a break now, and we'll be back in just a few minutes. Please stay with us and come back and join us in just a minute after the break.
Stay tuned. West Texas View will be right back.